Hi, Spunky Spunk here. Today I'm going to be sharing a little bit about me. To as far as I'm aware, I'm the only one who has had a successful pregnancy and was able to deliver a baby without citrullinemia while having citrullinemia. Currently, my son's on spring break, so sorry if you hear them in the background. He's got a friend over. During the beginning of the pregnancy, I threw up for one whole day. Couldn't keep anything down. Medicine, food, drinks, nothing. I would eat it, it'd come right back up. That that spiked up the ammonia level to 288. And I was actually about 4 hours away from my genetics team. I couldn't wait until they would be in that office down there, but my aunt was able to come down and get me back here within the time. We did go to the emergency room, and after speaking with my team and whatnot, we decided to do, at that time they call it a bolus dose, which that means just isolating the arginine, sodium phenylbutyrate, and sodium benzoate. Those three medicines help extract the ammonia. You've got branch chain amino acids, which have a very, very small amount of protein. Not sure how many people are actually on the smaller amino acids, like leucine, isoleucine, valine. But those ones, when I would get sick, I wouldn't use those. So we didn't do those. The next morning, I did go in for a recheck of the ammonia level, and it had come down to 65. They did run a pregnancy test, and that came back positive. I was 4 weeks and 1 day pregnant. Everybody was shocked that I found out that early on in the pregnancy, and I had such an amazing genetic team that I don't know if it would have gone as smoothly if I didn't have such an amazing team that worked with me. Yes, the doctor was worried about the outcome. He did warn me about the worst case scenario, what could happen. He warned me of all possible bad outcomes, such as he could be living on machines, I could be living on machines, we both could be living on machines. He could die, I could die, or we both could die. Or one of us would be healthy and the other one would fall into a coma. And at that time in my life, I didn't exactly follow the rules. So I threw it all in. I gave it my all, and I was determined to be a mom. So I kind of threw it all to the wind. I followed the geneticist's orders. I worked vigilantly with the dietitian. She was awesome. She said I could call her, anytime. She was pretty much willing to work with me if I did have a question. Uh, During the pregnancy, one thing that I craved more than anything was cheesecake. With citrullinemia, you can't have cheesecake, so it was hard. The baby wanted meat and cheese, and I can only assume that that's not the case for everyone, especially if they haven't had meat. But when people would cook, oh, okay, here's a good example. Someone would cook steak, and I would be like, oh my god, that smells so good. What is that? I would like to try some. It's like, that's steak. Never tried it in my life, never even one little bite, but I wanted it. It smelled amazing. Also, it was amazing. After that first spike that I had, the rest of the pregnancy was smooth sailing. I had the lowest ammonia levels that I had in a long time. Like, there was even a point in the pregnancy where the ammonia level would like drop down as low as like 9. So it was pretty incredible. And for his little body to be working like extra hard to keep not only me going, but him going as well. He flipped upside down at 3 months, and I was put on bed rest. That was tough. Yeah. As for the end, every parent wants to know this. How long was I in labor for? Well, I was in labor for 22 hours. It wasn't as bad as everyone said. He does not have any symptoms. He's never had a high ammonia level. He had a bunch of tests when he was born, and he does not have it. I'm not sure if they tested him to see if he is a carrier. I'm fairly confident that he is 100% a carrier. If there are any questions that I'm not addressing that usually pop up, feel free to leave them in the comment section. I'll get back to them. Now, since he's on spring break, I'm gonna go and go play video games with him. Questions, comments, leave them in the comment section. I'll get back to them. Hit that like button, subscribe, and I'll get back to you. Bye!